Hello everyone, and welcome to Lake Superior Quality Innovation Network Learning Session 2, Making Changes that Result in Improvement. LSQIN represents Michigan, Minnesota, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization Program. This is the first webinar of the series, which will review the IHI Model for Improvement and will focus on the third component of the model. What changes can we make that will result in improvement? I'm Liz Dominguez, Nursing Home Project Specialist at Metastar. Following this webinar, you will be able to better recognize the importance of developing a structured approach of how to identify changes that result in improvement. You will also learn about various methods used to identify needed changes that will lead to improvement. And lastly, you will use what you have learned and decide which method works best for you and your interdisciplinary team, and try it out on a current issue that your facility may be experiencing. Let's start with an overview of IHI's Model for Improvement. The Model for Improvement was created so that it asks team members 3 questions. The first question is, what are we trying to accomplish? This question will ensure that teams will have a specific outcome that they are trying to reach. Question 2 asks, how will we know that a change is an improvement? This question allows teams to identify measures that they will be using along the way to track their progress and ensure they are going in the right direction. The third question asks, what changes can we make that will result in improvement? This is where teams identify the key changes that they will actually test. The key changes that a team identifies are then implemented into cycles of Plan, Do, Study, Act, or PDSA, where the testing of the interventions is performed. PDSA cycles will be further discussed in the second webinar of this learning session. With emphasis of this webinar being on the third component of what changes can we make that will result in improvement, we will now take a look at the various methods of analyzing existing processes and exploring opportunities for improvement. These methods assist teams in generating ideas and making decisions for positive change. The 4 methods include flowcharting, process mapping, brainstorming, and reviewing of evidence-based practices. Now we'll take a look at the first method, which is brainstorming. Brainstorming is a free-flowing generation of ideas. What's good about this method is that it can create a high volume of ideas as the team is encouraged to become involved to think up these ideas. During a brainstorming activity, all ideas are welcome and team members can build off the ideas of others. Discussion of whether the ideas are feasible, cost-effective, and so on happen at a later time. Brainstorming is useful because the team approach of thinking up new ideas can assist you when you feel that the same old things are no longer working. To brainstorm with your team, you can choose to do it 2 ways, structured or unstructured. When structured brainstorming occurs, start by clearly stating what the question is. Each team member then, one by one, gives an idea. Remember to write down the ideas and ask for clarification if needed, so you can ensure that you're capturing the exact idea of the participant. Keep going from team member to team member until no further ideas are being generated. This process doesn't have to be long. It can take as little as 5 minutes. After all the ideas have been generated, review the ideas with your team and eliminate the ideas that are duplicates. An unstructured brainstorming session differs in that all ideas are shared by everyone participating at any time. The next method we'll look at is process mapping. Process mapping can be defined as the process of creating a diagram that illustrates a business process or workflow process. It's important because it allows teams to map out the actual flow or sequence of events. So what are the benefits of process mapping? When done correctly, process mapping shows where you are doing rework and where problems or potential problems are occurring or could occur. Once the process map is completed, it also shows you where you are currently at, which will enable you to better identify where you need to be. A Upon completion of process mapping, the resulting tool is called a flowchart. When creating a flowchart, typically an oval shape is used to represent the start and end points. A box shape represents a process or activity to be performed. A diamond shape signifies a point where a question is asked or a decision is required. Before creating a flowchart, identify who is involved in the process. The team members identified as having a step in the process should all assist in completing the flowchart. It can also sometimes help to have a person who isn't part of the process because they may see things in a different way and identify areas for improvement that the involved team members may not as easily see. Once your team members are together, the first step in creating a flowchart is determining your start and stop points. Next, decide how detailed you want the flowchart to be. It can be simple enough to convey the general process flow or more detailed to include all decision points. After this, brainstorming can be used to identify all activities, inputs, outputs, and decisions. After brainstorming, arrange the steps in the order that they occur. Sticky notes work well since they can easily be changed or rearranged. Let's look now at an example of process mapping and flowcharting in the nursing home. In this example, the nursing home administrator received multiple complaints from residents and families about the supper meal arriving late and being cold when the residents ate in their rooms. She realized that residents who ate in the dining room were not having the same concerns, so she took it upon herself to learn more about the process of the supper meal service by using a flowchart. And now we'll take a look at the steps taken to create a flowchart as it relates to residents receiving a timely meal. The nursing home administrator began by involving dietary and nursing staff when creating the flowchart because they were involved in the process that needed improvement. After ensuring the proper staff were involved, she defined the start and stop points. The starting point is supper time at the facility. The end point is the resident eating their supper. In this example, we will assume that the resident is already in their desired eating location, either their room or the dining room. Two paths were then determined based on where the resident eats. Each step was then discussed for each option. Boxes were used to portray each step of the two processes to assist in figuring out why meals were arriving late for residents who ate in their room. After completing the steps, it was noted that there were double the steps for the residents who eat in their room. So this was further discussed to get to the root of why trays are being served late and to find where efficiencies and improvements could be implemented. It was determined that the normal process is for dietary staff to bring the supper cart to the unit and then they return to the kitchen. Many times, however, CNAs would be in resident rooms providing care to the residents when the cart arrived, so they were unaware of the arrival of the supper cart. The cart would then sit on the unit until a CNA noticed that it was there. The CNA who first saw the supper cart then had to find the other CNAs and notify them that the supper cart was on the unit, all of which was taking extra time. The team discussed options to remedy this situation, and their final decision was to have the dietary staff notify CNAs when the cart was brought to the unit. This way, staff could communicate with each other and meals could be promptly distributed. In this example, the team identified that this was a systems issue, not a person or departmental issue. Here is another example of a nursing home, Nazareth Health and Rehab in Stoughton, Wisconsin, and how they use process mapping to create a flowchart to improve a process. So Nazareth had a policy and procedure in place that addressed the monitoring of Coumadin. We still noted inconsistencies in some areas of this monitoring. Knowing that quality improvement works on existing processes, we needed a pictorial representation of the sequence of actions of anticoagulant monitoring within our facility. A committee was formed to review the current facility process of monitoring anticoagulants. We analyzed our current process and put it into a narrative format. It was from this narrative that we created a flow sheet. The flow sheet allowed for us to identify areas of weakness and generated ideas for improvement. It was through this process mapping that we were able to improve our system for Coumadin and INR monitoring. So by use of this process, this nursing home was able to discuss the components of the system and identify barriers, and were able to improve the monitoring of this sometimes hazardous medication. Thank you, Nazareth Health and Rehab, for sharing this improvement effort with us. Before we move on to evidence-based practice, let's take a look at the change package. As a quick reminder, the change package is a collection of ideas and themes that were found to be common among high-performing nursing homes. Along with the strategies listed in the document are specific action items, which is how the nursing homes carried out their strategies. Related to making changes that result in improvement is strategy number 5, be a continuous learning organization. The change package specifically states that when something goes wrong or could go wrong, this is the perfect opportunity to discuss processes and systems involved, and this is where process mapping can be useful. Also, when making improvements, involve employees who contribute to the process, which will most likely include members from multiple disciplines. And lastly, the change package mentions that teams should take advantage of existing performance improvement tools that guide systems thinking to define the problem, such as flowcharting. And if you haven't looked at the change package yet, the link to the change package can be found on the LSQIN Nursing Home homepage. Lastly, we'll take a look at evidence-based practice, or EBP, and why it's important when making improvements. Evidence-based practice can be comprised of clinical expertise, the best research evidence, and patient values and preferences. Use evidence-based practices to guide the development and revisions of your facility's system. In addition, use EBP in your facility's process mapping and development of flowcharts. Remember that your facility's medical director is crucial to the overall medical care delivered in your facility. Ensure their involvement in the implementation of evidence-based practice. Here are a few examples of evidence-based practice resources: the AMDA guidelines, Interact Pathways, which can assist in management of acute changing condition. Advancing Excellence's clinical and organizational goals contain evidence-based resources that can be used when your facility is working on their goals. And lastly, the Try This series from the Hartford Institute for Geriatric Nursing. Taking another look at the change package also includes the use of evidence-based practice in strategy number 6, compassionate clinical care. The change package states that evidence-based pathways, policies, or procedures should be used for common conditions, such as pressure ulcers and infections, and you should also ensure that staff have been trained and are supported before implementing any new processes. Also, evidence-based tools and resources should be used to manage conditions that often contribute to rehospitalizations, which may include CHF, pneumonia, aspirations, or UTIs. Now that we have discussed the various methods that can be used when implementing change, here is your activity. Choose and practice a method to identify needed changes. The activity handout includes a description for both flowcharting and brainstorming. While planning and implementing improvements, also remember to include evidence-based materials. Also, please remember to watch the other 3 recorded webinars in this learning session, as well as complete the corresponding activities with your team. And lastly, as always, if you have any questions, please contact Kathleen in Michigan, Christy in Minnesota, or myself in Wisconsin. Thank you.